about 20 cases with an additional case, a 21st case that had just come in. I did indicate that that individual is in Muskoka, and today I have detail that I can provide with regards to that particular case and a number of the other cases that are new. But first I'm going to go to the bigger picture. As I've indicated, our data that we have on our website speaks to 26 cases. They are in age clustered in the middle age range, 35 to 64. We do have 4 that are in a younger age group between 18 and 34. We've had 5 that are 65 or older, and 2 that we need to get information on. In terms of their status, we 16 of those who are in self-isolation, recovering at home. We have 5 who are hospitalized. We have now 3 who are deceased. We've had an individual pass away yesterday, and I will get into some of the detail about it. And we have 2 that are under investigation. In terms of the source of their infection, 14 are travel-related, 3 are close contacts of other cases, and 6 are community-acquired, and 3 are under investigation. I would point out, with regards to the hospitalized cases, they are relatively young people. They're people between the ages of 30 and into their 50s. As I pointed out, having 6 community-acquired cases is cause for concern as well. It speaks to the fact we do have community transmission happening in Simcoe, Muskoka, and therefore people need to take to heart and exercise the physical distancing practices that we are calling upon for everybody to do, and that really comes down to thinking twice before going out. If you do go out, being at least 2 meters from other people, avoiding crowds, if you certainly hand washing on a frequent basis. If you do develop symptoms of a respiratory infection, you should be isolating yourself at home and seeking further assessment, particularly if you develop severe symptoms or if you are a healthcare worker. And there's information certainly that people can get on our website, or they can call us health unit or telehealth or their family practitioner for further recommendations on what to do. Now is the time for people to be implementing these practices. We are at the point where we're going to get more and more of the way of community transmission, and the more we're able to, all of us, exercise physical distancing, the more we're going to be able to flatten the curve and reduce the surge of cases and the demand on the healthcare system. I'm going to walk through some of the detail. We had, I would say, a strong request for us to give local municipality information on where the cases live, and so we put that back in. I had indicated before why we moved away from that. It was really the importance of people knowing that there is community transmission happening in their community, whether or not their community is on this list. And we wouldn't want people to have the mistaken view that if they know individuals who may be cases, they can avoid them. What is far safer for people to do is assume they don't know who could be a case, because we certainly don't know all the cases. There's probably many more cases in the community than what we are learning of through testing, given that there's a limited access to testing, and given that some people can have very mild or even no symptoms and yet be able to transmit to others. So that takes you right back to the importance of physical distancing, maintaining your distance, and washing your hands. I have spoken to the importance of thinking twice about going out in the community, and I think that's generally good advice. However, it is necessary for us to go out in the community at times. We have to go out to go shopping and buy medicines. Many of us still have to go to work, even though non-essential services have been discontinued. And so when people go out, they do need to exercise the physical distancing, the maintaining of distance from others. But it's also important for people to take care of their physical and mental well-being or health, certainly at this time of great stress. And so I think at times people will need to get out to be physically active, and when they do, they need to exercise the physical distancing to make sure that they're safe and to avoid certainly crowded areas. There may be areas in your community that continue to be frequented by many people because they're popular places to walk. I think that that's potentially a dangerous situation, and we're in communication with our municipalities about that and what they can do about that. And I would suggest that individuals avoid such places when they get out for walking. So looking at our cases, starting with what do we have on our list, the 21st case, that was the case from Muskoka that I wasn't able to give information on yesterday. I can say today that that person is staying in self-isolation in Huntsville, a male in his 20s who is a travel-related case, had been to Austria and Switzerland. With regards to the individual who has deceased, we note that this is a woman in her 70s who had been admitted to Aurelia Soldiers Memorial Hospital. She was a community-acquired case. There was no link with any travel or any individuals that were known to be cases. And her passing was yesterday. I would like to express my condolences for the loss of the family member with regards to this woman. I would also draw your attention back to the list and just walking down the list from 22 onward. Case number 22 is a woman in her 40s in Barrie, in self-isolation, and with regards to how she acquired her infection, that is presently under investigation. We have in our listing a man in his 60s in Aurelia who's under self-isolation, who is travel-related, having traveled to Austria. We have another male in his 60s living in Essa in self-isolation who traveled to Dubai and India. And then the last two cases, as I said, are under investigation. The other, I think, important thing of note among the cases is that we have some difference in gender. I'm just noting that there are more men than women that are becoming cases. Of 25 of our cases, of the 26, where we have information about gender, 16 are men and 9 are women. So I think that men perhaps need to take note about the importance of social distancing perhaps as well, as possibly something of note for themselves. We've had certain questions that have arisen and also certain points that I want to make. So one of the questions that came up yesterday was expectations. Why, if we're exercising social distancing, are we not seeing the cases come down rather than go up? They're certainly going up quite steeply. We've had more cases, new cases today than we had yesterday, and that suggests that it's certainly not yet under control. I would say we need to anticipate that it's going to go up before it comes down, that anything that we do today, given the incubation period of this virus, will not have a visible effect until at least 2 weeks out into the future. And even with all that we can put to towards bringing this under control, we do anticipate some increase over time. We do know from modeling, mathematical modeling, that we can, if we're very good about physical distancing, greatly reduce the number of cases, as much as 95% over what they could be. So the potential is there for us to act now and be successful and avoid a surge that could be extremely difficult for us to manage in cases with regards to healthcare. If we act now, we can bring that down substantially, but I think we have to anticipate there will be some rise at this point in time regardless, and it will take place over weeks and months to come, going up before it comes down. Just having a look at some of the other questions. There was a question yesterday about Muskoka versus Simcoe and testing, and why perhaps we weren't seeing more Muskoka versus Simcoe cases, and whether or not that was related to the amount of testing. And so it was suggested that we look back at the number of tests that have been done overall, negative tests, as an indication of how much testing is happening. This is not a perfect measurement of this because we don't actually, at the Health Unit, get back all negative tests. We get them from the Public Health Ontario laboratory system, but we aren't getting them from some of the hospitals that are now doing testing. But even so, it is an indication that can have some value in looking at. And what we found is that the rate of testing by this measurement, by the amount of test results we're getting back, is indeed higher in Simcoe County than it is in Muskoka. The rate of testing in Simcoe is 12.8 tests per 10,000 population, as opposed to Muskoka at 8.8 tests per 10,000 population. And that is a statistically significant difference. I think that perhaps is noteworthy, and that being able to increase access to testing in Muskoka is perhaps highlighted by that. The importance of getting assessment centers in operation in Muskoka is perhaps highlighted by that. In making inquiries about when they would be in operation, my understanding is that they are still working to have their assessment centers in operation by early next week. But certainly this is important that they're able to do so. So just having a look to see if there's anything else that I might have missed. There was also a question about the problems that could arise in local healthcare clinics, hospitals, and other services due to the increased demand, and how people should respond or take precautions as they travel to the Muskoka district. So once again, there was concern, and this was raised before, concern about people coming to Muskoka to isolate themselves or to seek to exercise the physical distancing that we're talking about, perhaps going to their cottage, and whether that could lead to an excessive demand on the healthcare system in Muskoka. My response to that would be that could be an issue, but what is more worrisome to me is the need for everyone in Muskoka and elsewhere in Simcoe to exercise the physical distancing. It's community transmission from person to person that will lead to the surge that we're going to see, and therefore the physical distancing that we do is going to be the key factor in keeping that under control. So at this point, I would be happy to take questions.
Okay, it's Kathy Dermott, the media coordinator, who's moderating this. We have a number of people on the line. Is there anybody who has not yet identified themselves from the media for me?
That'd be me, Nathan from Moose FM.
Nathan, anyone else?
Yes.
Yeah, Nathan from Post. Dana from Global News.
So we have Dana from Global?
Yeah.
And Muskoka Post, did we have Agatha?
Yep.
Okay, anyone else?
Yes.
Doug
my name's
Doug from Muskoka Region. Anyone else?
Yep, Nick Dunn with TBO.
Nick. Anyone else? Okay. Well, why don't we start with yes?
Dr. Gardner. I'm going to make one more point that was on my list, and then we'll open it up, and that is travelers. When I look at the data, although we've got quite a bit of community-acquired transmission, we still have a substantial number of people, even in the last day, who are travel-related, and the federal government has just exercised its power under the Quarantine Act to order people returning to the country to go into home isolation for 14 days. That, too, remains a really important factor in this. So thank you for your patience with that additional point.
Okay, thank you. So let's start. How about Dawn Huddlestone? Do you have a question?
I do. Sorry, I was on mute again.
Okay.
My question, of course, is regarding the Huntsville case. Dr. Gardner, we know that there's a bit of a lag time in testing. So do we know how long ago that case was tested?
I will have that information at my disposal at a future meeting. Right now, I've not got it in my data set, so I wouldn't be able to speak to it today, I'm afraid. I have the date in which we got the report, and that was yesterday, the 25th. But not the date in which it was actually ordered or drawn.
Follow-up question?
Nope, that's good for now. Thank you.
Okay, how about Adrian, MyFM?
No, pretty much everything was covered that I wanted.
Okay. How about Doug Cross?
Yeah, hello. Wondering about the sort of knock-on effect with self-isolation could lead to more domestic violence. Is that an area where more resources may have to go from the health unit in terms of people being shut in together longer than they anticipate or that they're used to, and then that creates a secondary situation?
So that speaks to the potential for harm with these measures, the control measures that we put in place. And indeed, because this will be in place for weeks to months, very soon the public health community will have to start to grapple with how do we mitigate the harm of people having their lives so disrupted and being forced into isolation from each other, or perhaps in close quarters with each other and not able to get out, or vulnerable people being further marginalized, and this could certainly fall into the category of domestic violence. We don't have, at this point, good strategies identified to address that. We are starting to speak about the importance of considering this to be physical distancing and not social distancing, and that people need to maintain their social contacts and use distance technologies to do so. And I'm personally starting to speak to the importance of the fact that this is not, at least yet, a total lockdown, and therefore, although people need to be careful about going outdoors, there are certainly perfectly legitimate reasons to go outdoors, such as getting physical activity, and that too is important for mental health, just that they need to do it in a way that maintains the physical distancing. So we don't have a good answer for the particular issue you raise at this time, but I would flag that it's certainly an important one, and we need to grapple with it.
Follow-up question, Doug?
Yes, please. Speaking to the travel and sort of mandatory self-isolation order now, how is that enforced other than telling people that you have to do it instead of you should do it? Is there going to be any listings of where people's home addresses are and flat checks, phone calls, anything like that?
So with each of the directives that have come out, we've had to ask ourselves and find out the answer to that question. Who enforces? Therefore, who do we turn to help support enforcement? And so that's certainly true with this question. This is a federal act. There are federal agents who would be empowered at airports or other points of entry, but at this point it's not clear to us exactly how that gets enforced. We are seeking the answer to that because we want to do our part. If we have a role to play, even if it's just a supportive one of receiving reports of concern, we then forward to, say, the police, if they're empowered to act on this, that we would do so. And we've done that before when it comes to venues being open that should not be open. In those cases, we've been able to work with local police to be able to address them.
Okay, thank you, Doug. Nathan Schubert, do you have a question?
Yes, I do. Thank you. Good afternoon. I fear I missed part of this earlier, but Doctor, did you say there was a Huntsville case, and can you just elaborate on slightly with the information that you have available? There
is a Huntsville case. It is a man in his 20s. It is travel-related, and that individual is in self-isolation at this time. Great. And second question, community transmission, are you worried that this is going to cause higher rates of infection? Because this isn't just travel-related or coming in contact with a pre-existing case. This is something else. So what is the major concern with community transmission here in Muskoka? So that's a very good question, and that's one of my key points. We do have community transmission happening throughout Simcoe, Muskoka. I have no doubt the one case that we have in Muskoka was travel-related, but I believe we have every reason to believe that otherwise it's transmitting in the community. And sometimes presentation can be very mild or they have no symptoms at all and yet be able to transmit to others. So therefore, the takeaway message for everybody is they need to be exercising the social distancing in order to protect themselves and others from becoming a case.
Mandy at Rogers, do you have a question?
Yeah, I have a couple questions. Dr. Gardner, you talked about this at the beginning about the hospitalized cases, and it's quite concerning because a lot of them are younger, and it looks like it was community acquired. Do these people who are currently hospitalized have underlying conditions?
Some of them have some underlying conditions. Those who passed away were at higher risk of severe case and death. They were all in their 70s and had pre-existing medical conditions. But not all of those hospitalized have pre-existing medical conditions.
Interesting. And just to follow up to that, have we seen cases that were initially just self-isolating progress to hospitalized, or are the people who are presenting hospitalized right away?
By the time we heard of them as cases, had been hospitalized. One of the challenges for us is that there has been a focus on testing people that have had an exposure of some kind, that they've been travel-related, or that they've had direct contact with the case. And so we tend to only pick up the community-acquired cases because they're severe. At the point that they get admitted, they get tested. And that speaks to even greater potential for this to be transmitting in the community that we otherwise haven't been picking up on these cases because they haven't been, those that don't have those risk factors haven't been a priority for focus to date.
Got it.
Thank you.
And sorry, one more.
Do you have a
Sorry, I
question?
just have one more question, Kathy.
Oh, okay.
It's just about new symptoms that are being discussed, loss of taste and smell. Have we seen any of that in any of the symptoms in these cases?
I cannot speak specifically to that particular symptom. That doesn't jump out to me, but then again, people wouldn't necessarily be looking for that, something as different as that. Certainly, we've had a full spectrum of presentations from extremely mild to critically ill.
Thank you.
Matt Fittler, do you have a question?
Sure. Dr. Gardner, we get a few reports here that people who should be in self-isolation are either operating businesses or are at businesses that should be closed. What's the procedure for people to report those businesses? Does the health unit have any jurisdiction over it like you have with the restaurant in Huntsville with the Hefe case?
So because the directives have been from the province or federally, as I said, we had to clarify, and with the decision yesterday about the Quarantine Act, we're still clarifying who has jurisdiction. And to date, what we've learned is the police that actually can enforce. So we have a very strong interest in action being taken in these instances and have been directly involved working with the police to take action in instances such as that. And we've been informed of them by third-party calls, people from the community that have let us know about it.
Okay.
Do you have a follow-up question, Matt?
Just that it sounds like the health unit wants to know about it at least.
We definitely want to know about situations that involve large numbers of people. So somebody who's going to a workplace or running a workplace who should be in isolation, that means that many people could be exposed, or public gatherings that shouldn't be happening, many people could be exposed. So we definitely focus in those areas. We have far less ability to focus on suspicion of individuals where you don't have that kind of exposure happening.
Okay, thanks.
James Bowler, do you have a question? You might be on mute. Okay, I'll come back to you.
Sorry, Kathy, I'm here. My phone was just acting up. Sorry. Yes, Dr. Gardner, sorry. So I think there's a mentality here. Obviously, there are people that aren't taking this very seriously right now, but I think there's also a mentality that this is going to blow over in a week or so. Can you just kind of help drive home the point of, how long we could be seeing, a self-isolation situation last?
Well, I think perhaps the situation in China might be instructive. Their outbreak commenced in December, and they've maintained tight controls until really just the past week. So that's over 3 months that they've had to maintain controls. They're just now relaxing some of those controls, and there's actually a lot of concern that they could end up with another wave of outbreak if they're too quick to relax their controls. So I believe people should be planning for this to be lasting months.
Thank you.
Okay, Erica Engel, do you have a question?
I do. I have two. The case number 19, the Bradford woman who is hospitalized. Do you know where she's hospitalized?
In South Lake Hospital.
Okay.
Follow-up? Do you have a follow-up question, Erica?
No, I can't remember it. Sorry.
It's okay. Chris Simon, are you on the line?
Yes, I am. Thank you, Dr. Gardner. First question, is there any indication that the virus can be passed on from a deceased body? I'm just referring specifically to the cases at RVH and wondering whether any of the hospital staff there would have been at risk.
In theory, it would be possible. I'm not aware of any documented cases, but it certainly speaks to the importance of infection control practices and use of personal protective equipment in handling the body and certainly in carrying out any testing on the body. And those practices were indeed in place in the management of the two individuals who passed away, the two men.
Do you have a follow-up question, Chris?
Yeah, sure. So what then happens, I just haven't heard it discussed, what then happens to the bodies after the postmortem is conducted? Is it safe to hand it back to the families for funeral arrangements, that type of thing?
There are guideline direction, advice for the handling of the bodies. I've actually not inquired about the specifics in these cases.
Brett Glover, do you have a question?
Thanks, Kathy. I do have just the one. We're hearing grumbles, Dr. Gardner, of the coming week is going to be crucial in the war against COVID-19 in terms of physical distancing. Can you speak to that at all?
We are transitioning from this being primarily travel-related, and it's still travel-related. There are many people coming back to Canada, and they are at high risk, and we still need to maintain the isolation that's required for them, and now it's legally required of them by the Federal Quarantine Act. But we're also seeing now community-acquired cases, and that is where the real danger lies. If you start to get more and more, and I believe we will get more and more transmission happening in the community, then going to have the potential for many, many more cases, and therefore there's a lot more opportunity for any of us to encounter this virus in the community. And often you won't be able to tell from symptoms whether you are being exposed by somebody who has and is shedding the virus. Hence the need right now for people to exercise social distancing or physical distancing. The more we can do that now, the better. While it's still relatively contained. The more it gets entrenched and the more people are affected, the greater the risk of transmission for everybody else.
Follow up, Brett?
No, thank you both for your time.
Okay, thank you.
Kathy,
Yes.
I'm sorry, it's Erica again. I remembered my question. Could I still ask it?
Sure.
Okay, I just wanted to follow up regarding self-isolation. There's a lot of cases that are recovering at home in self-isolation. Does the public health unit follow up with them during that time?
We follow them closely as well as their contacts. We follow provincial direction on when they can come out of isolation. That has evolved as our understanding of the virus has evolved. At this point in time, it's fairly complicated. Depends on whether or not they are healthcare workers, because we don't want healthcare workers going back into their work environment and potentially infecting others if they're still infectious. But for the majority of them, what we would be looking for is 14 days following the onset of their symptoms with a complete recovery of their symptoms, whichever is longer, either the 14 days or however long it takes for them to recover. For healthcare workers to be able to go back to work, they also have to have 2 negative tests for COVID 24 hours apart. And we do follow them all.
Okay, good. Dana, do you have a question for Dr. Gardner?
Yes, I have a couple. So the first question I have is that we're seeing every day new cases in Simcoe, Muskoka, and of course we're going to know the actual effects that the physical distancing and staying at home has had more clearly in a couple weeks. But are you concerned at all about about how this is going to weigh on our healthcare system, and if locally we're going to be at capacity or over capacity?
Indeed, I am concerned about the potential for the virus itself to lead to us being over capacity. The great challenge for us now is to flatten the curve with social distancing and with self-isolation for those that need to be in isolation, and for case and contact follow-up. If we do all of that well, we can flatten the curve hugely, according to the mathematical modeling that we've used. So I'm very, very much concerned about that now, but I'm also very much concerned about the fact that we're going to need these controls for weeks to months, and they're very tight controls, and it is possible that the government may need to go even tighter controls. They talk about a complete lockdown in certain parts of the world. India has just implemented that now, that really fully restricts people from coming and going without having some kind of documentation allowing them to go to their workplace, or for that matter, that people would have to be going to shop for food or medications, and that's it. So I'm very hopeful we don't have to implement that kind of control. But even without that kind of control, the loss of people's work at this time is very stressful for people. The need to physically distance is very stressful for people. I'm sure it's particularly difficult for children who naturally need each other as playmates, and so to have that totally restricted for weeks and months will be very, very hard on them and their family members. And I'm concerned about the ability of people to get physical activity that they need, for example. I'm concerned about their loss of social interaction. It's an important point for people's stress overall, for their mental health and their physical health. And therefore, we need fairly soon, as a public health community, to start looking at how do we mitigate all of those impacts how do we reduce all of those impacts while people have to continue living with all of these restrictions associated with physical distancing? Hence, we've shifted our terminology. We talked about social distancing, and I'm trying my best not to slip up on that term. Now we talk about physical distancing, with the notion being that we need to maintain social contacts by other means, by distance technology means, while we maintain physical distance.
Follow-up question, Dana?
Yeah, and then the second thing I'm wondering is, can you describe the process in terms of how the health unit reports to the province? Today I saw the province had different reports of new cases in Simcoe, Muskoka than the health unit did, and it wasn't clear, but it looks like the provinces could have been the health unit's reporting from a couple of days ago. But again, I'm not sure, but just kind of wanted to follow up on that.
So the province also receives our laboratory testing, and therefore they know of the cases that we know of. The attending physician also receives the laboratory testing, and they receive from us through a public health information system data that we enter about the cases, and we do that well within the day that we receive this information. But they have a lot to deal with, so they're dealing with everything happening all over the province, and they may very well have more of a lag in getting their information up on their website compared with us.
Okay, fair enough.
Agatha, do you have a question? You might unmute.
I'm sorry, who was that?
Actually, Agatha, do you have a question?
I do.
Yes.
Dr. Gardner, you had mentioned that by the time that patients are being hospitalized, or by the time they're being tested, they have already been hospitalized. So I guess my question is, was the Huntsville case hospitalized and then released home for self-isolation?
So my point was that of those who were hospitalized, we were finding out about it at the time they were hospitalized, that they had progressed to the point of being serious enough that they needed to be hospitalized. That's when they were being tested, and then we find out about it through the test result. Others who didn't require hospitalization, they're tested often at a hospital because it's hard to get a test done elsewhere. The assessment centers, some of them are now progressing to the point where they will also test. But the Huntsville gentleman that we're talking about was not actually hospitalized. He was tested, but not hospitalized.
Follow-up question, Agatha?
Yes, I do. So yesterday, the Muskoka Algonquin Healthcare issued a need for PPE equipment. Have you spoken, or are you in touch with the Muskoka hospitals to see what their capacity currently is at, and in terms of do they have enough ventilators, et cetera? Are you in touch with these hospitals on a regular basis?
I have a teleconference with the CEOs of all of our hospitals on a weekly basis as one of our ongoing connections for information. 2 weeks ago, we also held a virtual meeting of the leaders of all of our hospitals and EMS and municipalities, school boards and other stakeholders, community service providers, just for the morning to walk through their state of preparedness, their plans, their challenges. So I get a fairly up-to-date rendering of information about what's happening. And then we have staff who are also in intimate connection with the assessment centers as well in order to be able to provide our support to their operations, or they're in touch with those who are developing assessment centers such as in Huntsville and Bracebridge.
Mike Arcelides, do you have a question?
Doctor, good afternoon. How broad do you believe the web is, the net here, of those who are either infected or in proximity to those who have been infected right now, based on the data you've received?
I always say that surveillance data is the tip of the iceberg. You only see what's the surface, and that beneath the waters is much more. It could be 10 times or even greater, maybe 100 times as much in the way of circulation in the community as what we know of through testing. there's a limited ability for people to be tested, and there are many people who are going to have very mild symptoms and won't seek testing. And that takes you right back to the importance of people exercising the physical distancing recommendations that we have at this time, considering whether or not they need to go out, 2-meter distance from other people, avoiding crowds, frequent hand washing, and isolating themselves if they develop symptoms.
So in your professional opinion,
do you have
there
a follow-up
could be...
question, Mike?
Yep. So in your professional opinion, there could be thousands right now infected in Simcoe, Muskoka?
It is possible.
Thank you.
Nick from TVO?
Yeah, hi there. So I missed a good chunk of the meeting, so forgive me if I'm treading on, territory we've already covered. But I'm curious as to whether or not the Simcoe Muskoka Health Unit is coordinating at all with Toronto Public Health, as there are concerns of seasonal residents coming up into the region. So I'm wondering on that level, what has communication been like with Toronto Public Health?
So the public health system, the practitioners of public health have a broad network of communications among ourselves throughout the province, and we also monitor very closely the media coverage of what other health units are doing. And certainly Toronto Public Health has always been a leader among us because of its size and capacity, and because there's so much media attention drawn to Toronto Public Health. And when we also operate on interconnected data systems. So our infectious disease reporting system that we have is a provincial database system. And when we do have cases that cross borders and involve other health units, then our staff make direct reporting contact with those other health units to coordinate action and follow up. So your question was about people coming to Muskoka. Certainly, people from the Greater Toronto area would hear media messaging from their local health unit, Toronto or otherwise, about the importance of physical distancing and the fact that community transmission is happening. Hopefully, they would take those messages to heart. I am seeking to reinforce those messages here. There is, of course, nothing that we can do to stop people from getting in their car and going to their cottage in Muskoka, or for that matter in Simcoe. At this point, we're limited in being able to give public messaging that hopefully that they and everybody else would take to heart.
For sure. As a follow-up to that, I'm wondering if any of the cases we have in Simcoe, Muskoka are from residents of the GTA or outside of Muskoka who have, traveled here perhaps to self-isolate. Are you guys making note of any of that data or making it public in any way? Perhaps it's not productive to just be blaming seasonal residents, but it certainly is relevant in the context of how the virus spreads.
So we've had instances of people from out of country that are staying here while they recover. We've had instances of people from GTA municipalities that are here and recovering.
And are you concerned about any kind of added strain to hospitals, other healthcare resources as a result of any potential influxes of seasonal populations?
I am concerned mostly about community transmission and the great potential for large increase in cases throughout the populations of Simcoe, Muskoka. I'm concerned about that. That's where my main focus is, and so travel is indeed part of our lives here, and I'm sure for that matter that there must be some people from Simcoe, Muskoka that are also at this time traveling out of Simcoe, Muskoka.
All right, that's all I have. Thank you, Doctor.
Okay. Did we miss anyone, or did anybody come late? Okay, very good. Okay, well, thank you for joining us today. We will meet you again tomorrow. Thank you.
Goodbye, everybody.
Thank you.
Bye.
Thank you.
ergonomically, things are challenging, but you just do it, man.
Yeah.
You know, I don't know. You have to ask questions, and hopefully you get the right answers. And I try to set my shows and show files up the same for every band, so that I can get around consoles. So the learning curve isn't so high.
Yeah,
You know, once these things are set up, you have to be fast. Is basically the thing. Like I was saying earlier, like things are always changing, so you have to be able to react to the guitar solo or a singer dropping their microphone or whatever's going on. You have to be able to be quick and be on those elements.
Yeah.
And so yeah, that's part of the key, is to set anything that's new, to get it to be as close to the way your workflow is, the best you can, basically.
Yeah.
But it's not easy. Like I just was at a seminar the other day, learning how like the newest ways to tune PAs and the new software, and you're constantly evolving. But that's, to me, the best. That's really the best part of this whole thing, is that it's always changing. Like you never have the same thing twice, for the most part. Even if you have your show, you know, on snapshots, so everything is the same, relatively consistent. It's always different. There'll always be a different room. There's always going to be another new piece of gear, or it's always changing, basically. And that's the best part.
Does the working with different bands, like I know you worked with Monster Truck, Monine, and now the new artists, do you find working with the different artists kind of increases your listening, or open up? Are you always adapting? Obviously you are adapting all the time to the different groups, but do you find even within the groups you're working with that you're kind of transitioning, or are they pretty well stuck in a sound that they want to get across?
I think that my forte is knowing what bands sound like, because I listen to so much music. You know, like I don't just listen to one style of music. I listen to everything, and I listen to a lot of music, and it's always happening. So no matter what band it is, I instinctively know what they should sound like. Yeah. Not what they should sound like, but what they sound like. And you just kind of want to get that across. You know, if it's a loud guitar band, like make the guitars loud. If it's a more pop thing, you know, you just make it sound how they sound, and it's easier to do that when you know what pop music sounds like, and where you know what rock music sounds like. You know, do you know what I mean?
Yeah.
And I pride myself on being able to do that, and quickly. Like, you know, and I've done a lot of festivals, front of house of festivals, where you're mixing 3 days straight every day, and every single band is different. And being able to make those bands sound how they sound really quickly, like within a song, is again, I pride myself on being able to do that. And it's important to you know, when I start to work with any band, I listen to their whole catalog, and some of it's great, and some of it maybe I wouldn't be that into, but I still listen to it. And if there's a cue that I think is important, that I think is integral to the song, I memorize it and have a cue sheet. And if anything that's important, you make sure that the song is getting across the way the artist intended it in the first place. And then as you develop over time, you start developing sound, you start figuring out what could be better, and you start improving things incrementally over years, you know. And the longer you have with a band, the more opportunity you have to do that, and then you get to cultivate your sound, my sound, or their sound, and build it to be the best that it can be, you know. And nowadays, because with virtual sound checks and being able to record shows, we can listen back to things. We can listen back to the show through the PA like they're playing, and I can simply say that part's not working, and am I doing something wrong, or is it something we can change up there? And we can analyze it pretty clearly. Cool. So there's no opinion, you know what I mean?
Yeah,
there's no like, it's not my opinion, or it's like, this is what it's doing, and you can hear it for yourself.
Yeah, it speaks for itself.
Yeah, maybe you like it out of tune, or whatever it is that's going on. You know?
Each his own. What's your favorite city? Would you say that? I mean, you have traveled pretty well here, there, and everywhere. What's your favorite city to?
I don't know, man. There's cities that like. There's cities that when you go to, you feel like it's like a huge cultural, like, your mind is blown just by it being such a different culture. So, and I mean, there's so many examples. I mean, Tel Aviv is a really incredible city. I love going there. Istanbul was really wild. Tokyo is obviously one of my favorites. But there's also little cities like